participate with the RECIRCULATE program under the RECIRCULATE initiative, also in partnership with Actuate as Lancaster University project. And today it's obviously within the Health and Sanitation theme month for the Participate project. And we are focusing on sanitation, obviously health and sanitation. And we've got a good list of incredible speakers, and we're hoping we can have some good interaction today as we proceed with the seminar. The theme for today's seminar basically is how can Africa improve sanitation and health in its low-income urban settlement? So how can Africa improve sanitation and health in its low-income urban settlements? Some kind of an overview. I see an estimated 60% of all diarrhea deaths globally from data shows that this can be attributed to poor water and sanitation. And though the proportion of global disability adjusted life years due to poor water and sanitation has declined, conditions in sub-Saharan Africa generally remains very, very high. And this is obviously due to low coverage of basic water and sanitation services. Most African countries have less than 50% coverage in basic sanitation across board. And in 2015, about 14% of population in sub-Saharan Africa use shared toilet facilities compared to the global average of 8%. 31% use unimproved facilities compared with the global average of 12%. And 23% practice open defecation compared with the global average of 12%. So you can see fundamentally across all data sets, Africa is performing really, really poorly. Now, poor access to water and sanitation hygiene as wash is obviously a very main issue in fecally associated infections such as cholera, diarrhea diseases, which remain the second leading cause of morbidity and mortality among children. But in order to tackle these problems, we're hoping that we can have a series of discussions and presentations to help us critically analyze and assess the potential for individuals either working as through partnership with organizations to help deal with this problem. Now, Lancaster University has won several grants, and prominent amongst which is the Actuate and RECIRCULATE project, which is sponsoring this webinar today. And so without further ado, I want to call on the first speaker who will give us a sense of the project itself. He's none other than Professor Kirk Temple. Now, he's a professor of environmental microbiology with over 30 years of experience. His main fields are in the areas around organic contaminant biota interactions in soils and risk assessment, bioremediation of contaminated land. And most recently, he's developed a great interest and working expertise in bioenergy and the use of microorganisms for energy generation and the application of such as byproducts for soil amendments. He's the Assistant Dean of International Faculty of Science and Technology, Lancaster University. He's the Interim Director of the Future Cities Research Institute, and currently he's the Director of RECIRCULATE and Actuate projects. Absolute pleasure to welcome Professor Kirk Temple to give us an introduction to the webinar.
Thanks very much, Akan. Can you hear me?
Very clearly, yes, boss.
Yeah, that was a very generous introduction. So thank you very much. It makes me feel very old when you say 30 years, 30 years. It seems, yeah, a very long time. But anyway, what I'm going to do now is I'm going to share my screen. So if you just bear with me for a second, I will attempt to do this. So can you see that, Akan?
Yes, very clearly. Yes, we can.
Okay, so I'm now going to try and put it in presentation mode. Is that in presentation mode, Akan?
Yes, that's perfect. Yes, proceed, please.
Okay, thank you. Well, good afternoon, everyone, and it's a real pleasure to welcome you to the next instalment of the Participate webinar series. As Akan has already said, my name is Professor Kirk Temple, and I am heavily involved in this project and others, in fact. And from a more wide perspective, or a wider perspective rather, I'm involved in a number of international activities with the university at large as well. So obviously the focus of today is international health and sanitation. and really asking the question, I'm sure there'll be more than this asked today, can Africa improve its health and sanitation? Okay, it's a big question, it's an open-ended question, and I'm really looking forward to hearing people speak and contribute more widely during the webinar. But before we get to that, I'd really just like to introduce the project really by saying that really this project is built upon a lot of activity that's gone on historically between colleagues here at Lancaster and colleagues elsewhere in sub-Saharan Africa, and bringing together universities and research institutes, the private sector and industry, and of course government, and particularly policy. And it's all underpinned by a research centre here at Lancaster called the Centre for Global Eco-Innovation. And so what is RECIRCULATE? Well, RECIRCULATE is an acronym, and its wider title is Bringing Eco-Innovation in Africa, Capacity Building for a Safe Circular Water Economy. And as you can appreciate, of course, that's a real mouthful. So we just refer to it as the RECIRCULATE project, or even indeed RECIRCULATE. And the project is a 50-month project. We're just over halfway through now. And it's funded by the UK government's Research and Innovation, and particularly the Global Challenges Research Fund. And it brings together a collaboration across sub-Saharan Africa with our campus partner in Ghana, the Council for Scientific and Industrial Research in Ghana, the University of Benin, ATPS in Kenya, NCST in Malawi, Copperbelt University in Zambia, and BUST in Botswana. So it's a big project with lots of different partners involved. And really, the project was conceived as a shared vision, really. So we've co-created. We're in the process of course, co-designing and most importantly, co-delivering. And it really looks at how we support new partnership-based approaches to enable African and, of course, UK researchers to grow transformational impact through working with, in, and for their communities. And that community element is absolutely crucial. And community, of course, means many different things. It could mean research users, it could mean small, medium-sized enterprises, the private sector, it could be policy sector, but it could be actually the people who live in towns and villages and cities as communities there. And of course, what it involves is multidisciplinarity, so we'll work across a whole range of different disciplines, and of course, internationally as well. But I guess the key thing, as I've already said here, is the notion that this project is a real partnership. So really, the project is couched in the idea of a circular economy, okay, or a bioeconomy, or a green economy, or whatever you want to call it. And really, the starting point, and most relevant today, of course, is the problems that we have with the waste that we produce on a daily basis. Some of it we produce biologically ourselves, of course, in terms of urine and feces, but there's also other forms of organic waste as well that contribute to the problem. And what we're trying to do here is manage that waste in such a way that it does not impact upon, or the impact on us is much reduced by valorizing or adding value to that waste and using it to produce energy in the form of biogas, which we can use to produce electricity, heat, and cooling. And of course, as with any biological process, there is a engineering process, as denoted by the bioenergy reactor on the screen. There is a waste, and that waste is called digestate. But that in itself has value because it's extremely nutritionally rich and can be used as an irrigant, or indeed as a fertilizer or soil conditioner, to improve the quality of our soil and improve crop production, which actually is, of course, what we all strive for here, because, you know, the population of the planet is increasing and we need to feed that population. But of course, as with the bioenergy system, agriculture also produces its own waste, and of course that can feed back into this virtuous circular economy. Now, over and above that, within this virtuous cycle of science and technology that's going on that I've just described, there is also an element of how we maintain and continue the good work that's come out of this project and other similar projects beyond the funding. And one of the ways that we've thought about, and there's a lot of discussion going on here, is how we bring business opportunities to this virtuous circular economy to perpetuate the activities, and so that it can actually be used by communities for real in their everyday lives. And one of the ways that we want to do this, of course, is by spreading the word. You know, telling people what we're up to, why we're doing it, why it's important, the benefits it brings, etc., etc. And that's where this idea of knowledge exchange and engagement with communities becomes so important. At the start, Akan also mentioned the Actuate project, and again, Actuate is an acronym, and it stands for Accelerating the Adoption of Circular Sanitation Demonstration Systems for Improved Health Outcomes. Again, a real mouthful, so we stick with Actuate. And Actuate has actually come out of the good work that's gone on in the RECIRCULATE project, and it's enabled us to actually operationalise, or to begin to operationalise at least, the science and technology from RECIRCULATE in a very real way by building two demonstration projects, one in Ghana and one in Nigeria. And we hope through this additional project that we'll be able to show communities, show stakeholders that there are solutions to waste management, how it improves the health of communities, offers sustainable energy and food security. Obviously, education is extremely important in this as well, and that's very important, particularly for acceptance and, of course, engendering change over time, and allows, hopefully, people to embrace this notion of a green or circular economy. And of course, as I mentioned before, we're looking to exploit or explore new entrepreneurial business opportunities that actually maximizes the benefits locally, regionally, and nationally of all the work that's going on. So really, on to today, we've assembled a fantastic team of contributors from Lancaster and also from partners in sub-Saharan Africa. Of course, we have a few notables. We have, of course, Dr. Francis Boateng Agyenim, who is the project lead in Ghana, and we have Professor Caroline Thoruwa, who sits on our project advisory board. So because she's here, we have to be particularly aware of to be in our best behaviour, because she's one of the people who oversees the project and its activities. And so I guess just to finish off by saying that this theme within RECIRCULATE is actually really very, very important, because what it actually does do is bring together all of the research themes collectively, bringing together social scientists, microbiologists, engineers, people who are interested in policy, the private sector and entrepreneurs. But of course, most importantly, through this activity, we're also engaging with the real communities as well. And that's absolutely crucial for the success of this project as well. So on that note, I'd like you to thank you for listening to my little introduction, and I'm going to hand back to Akan. So Akan, back to you. Thank you very much.
Thank you very much, Kirk. Much appreciated. That was like a really good overview of what the project is about. And obviously within the project, it's obviously clear to everybody that health and sanitation provides a really, really fundamental, strong foundation on which most other work packages are built on. On that note, I want to introduce the next section, which will be a quick presentation from two persons. And the idea is, even though we consider, if you like, sanitation as a problem, which obviously it is, are there potential opportunities within the realms of health and sanitation? Of course there are. And so presenting a Ghana perspective, which I believe at the point of discussion and engagement with everybody in the group, we hope to explore if that is the case in other African countries. But obviously, presenting the Ghana perspective, I have Mrs. Charlotte Adjei. She's the program manager at the Ministry of Sanitation and Water Resources at Ghana. She's obviously an environmentalist by training and expertise with extensive experience in the field of health, sanitation, waste management, and policy development for Ghana. And the second person is Richard Boateng. Richard is a senior researcher and scientist and head of Sanitation and Environmental Management Division of the CSIR Institute of Industrial Research in Ghana. He has worked across different fields as a technical expert for the Environmental Protection Agency, EPA, in Ghana, but also the Ghana Standard Authority. And so Charlotte and Richard were giving us an overview of the perspectives around challenges of health and sanitation and the opportunities that Ghana provides. Over to you. I think Charlotte first. Thank you very much.
Thank you very much, Hakan. Good afternoon to you all. Greetings from Ghana. And I'm excited to be part of this discussion, especially when we are commemorating World Toilet Day today. I will share my screen so you can see the presentation. So I'll just give a short presentation. I'll give an overview of Ghana's situation, then the Ghana success story in improving household toilets, and then water supply for low-income urban communities, which is a project under the Ministry of Sanitation and Water Resources funded by the World Bank. And there's some challenges that we encountered, key lessons that we learned from the implementation of the 5 years project and the conclusion. So Ghana achieved our water supply target for the MDGs, but when we moved to the SDGs, we realized that we have about 92% of the people having access to basic drinking water. So we have like 67% rural and 81% urban. Then when we come to our basic schools, in terms of water supply, we have about 71%. But the situation of sanitation, the story is different. We are really lagging behind when we look at the SDGs targets. We have only 21% of people with access to basic sanitation, not even improved sanitation, basic sanitation. So we have just only 12% rural and then 24% urban, even though we are rolling out the rural sanitation model of CLTS with our partners, and we have made a great input, but still the gap is too wide and we need to run to catch up. And then in open defecation, we have 22% of the people practicing open defecation. And then when you come to our basic schools, access to toilets is only 65%. So it's really a big challenge also for our school facilities when it comes to toilet facilities. The government of Ghana recognized the situation. Therefore, we have a lot of interventions. We are using the multifaceted approach. So we use the rural sanitation models, then we use urban initiatives as well, different programs, different partners with World Bank, AFDB, and then from GOG funding as well to scale up and then increase access to sanitation and then water supply. So from 2017, we had only 14% access, and at the end of 2018, we had 21%, and we are hoping the next GMP survey will maybe go up a bit to 24 or 25%. So we have basically done only 7% increments when it comes to access to basic sanitation. We have this initiative only in the Greater Accra metropolitan area. We call it the Gamma Sanitation and Water Project. So the idea was to scale up household toilet access in these low-income communities, and therefore decided to use a different approach, a bottom-up approach, to see how we'll be able to scale up this target. For the period of the project implementation, we were able to provide inclusive and affordable household toilets to over 33,000 households, benefiting about 230,000 people in low-income communities in the Greater Accra metropolitan area. The water supply network, we were able to construct 282 kilometers of pipeline and 10,000 new pipe water connections, and then also 114 stand pipes, serving over 367,000 people. And this low-income water supply, we did not use the normal framework of people coming with their land titles to access water, but we moved to the communities with the local community support and approach, scrapping all the legal issues, and then just a landlord and the tenants verifying with their ID cards, we connect water to these households. And the school facilities also in these communities. When we did our baseline, we realized that most of the schools don't have toilets. So if you provide toilets in their homes and they go to school and there's no toilets, they have to still do open defecation. So the project provided about 406 disability-friendly and menstrual hygiene management considerate school toilet facilities. So we have separate blocks for the boys and girls, and then we also have changing room for the girls for menstrual hygiene management. When it comes to institutional strengthening and capacity building, we implemented the project through the municipal and the metropolitan assemblies. And we needed to have a simple tools for reporting, and then also for them to plan for these communities. So we developed a mobile application software, we call it ECCAPS. It's just expanded sanitary inspection, compliance and enforcement mobile form with questionnaires and a server. So when they enter the community, every household, sanitation and water data is captured and submitted. So we know which communities we have to move in to give them water, sanitation, and even provide solid waste interventions. Sustainability. We learned from other projects, WhatsApp, UNICEF, WaterAid, and we realized that when you normally give facilities to people without planning or designing with sustainability mindsets, you may end up losing a lot of the facilities. So we did a lot of participatory approach. We use a local capacity, the assemblymen, unit committee members, the chiefs, and then also we subsidized the facility and also created a simple platform that they can pay using a mobile platform. So you can just send your money, your contribution on a mobile platform. And then when you get to a certain stage, we construct the facility for you. But the sustainability of the institutional facilities, we have taken it to the ministerial level and calling on policy direction to change some of the instruments we have currently for O&M to ensure that there is sustainability on the management of school facilities. Forward-looking actions, we have also realized that in the low-income communities, because of lack of space, social and environmental safeguards issues, some technologies are difficult to implement in these communities. And with the compendium we use for households to select the type of facility they want, The biodigester became top of our list, and most of the facilities we constructed, we have septic tanks, biodigesters, and all that. So we decided to come up with a manual to help artisans and the municipal assembly officers to do proper engineering designs and all that, to make sure that whatever we are putting on the environment is also safe for all of us. And then also for the emptying too, we did manual to guide environmental health and safety in collaboration with the environmental service providers to make sure that we will achieve the SDG goal of safely manage on the fecal matter. And then also we have other stakeholders who are also partnering for the dissemination of these guidelines and then to guide the national policies as well. How did we do it? So for us to scale up all this intervention, we realized that the municipal assemblies or the city authorities is the one-stop shop for toilet provision. So anybody in the community, whether low income, you have land title or not, you can walk to the assembly and register for a toilet facility. And any interventions that is available, you have the right to access it. And then also we need different community engagement strategies to create momentum for toilets in homes. It's very critical, especially when you go to the coastal areas, their dynamism is different. And when you come to the CBTs, the commercial areas too is different. When you go to the slums, it's different. So we have to use different communication strategies to reach all these people for them to accept. Initially, it was not easy. If you look at the graph, at 2016, we were not able to achieve a lot. 2017, we were still struggling. But 2018, that is where we moved to affordable toilet options with flexible payment arrangements. So you can just contribute your $1 or 1 cedi on a mobile platform, and you'll be able to save to own your own household toilet. And we also realized that availability of service providers to meet the real demand for household toilets is also very crucial. Because at a point, we did a lot of sanitation marketing, we did a lot of engagement, people sign up for the facility, but we didn't have service providers to move to these households and provide them the toilet on time. So it's also very critical to have the markets ready, the SMEs, the SPIs, all over in these communities to provide the facility for them. And lastly, the education, we have to intensify sensitization and promotion of toilets in homes. People have public toilets, they pay so much to use it, but they prefer to go to public toilet than to use their own household toilet. So you are able to do sensitization and tell them the cost benefits they accept, and you'll be able to increase uptake of household toilets in these low-income urban communities. We also realized that the sewer networks, even though they pass these communities, they are not beneficiaries of it. A typical case is Tema Municipal Metropolitan Assembly. The whole city is sewered, they have sewer networks, but the low-income communities did not have access to the network. So we decided to have a simplified sewer systems in this community and connect them to enjoy the facility as well. So we selected 2 communities for the start, Bankuman in Tema and Ashaman Newtown. So we are going to connect about 4,435 in Bankuman and 5,455 in Ashaman. If you look at the layout of the community, it's very crowded community with no space, but of course the main line is there. So it's easy to have some networks into the communities, then the households will just connect their pipes from their toilet, and we will give them the bowls for them to be able to also use the facility. And it's easier when you already have the network. The layout passes this community. yet they don't enjoy it. So it's simple for you to just do a community networks to this main line. And then we are also adding to the treatment to receive this capacity that will be added to it to make sure that we get a very good environment for these communities. The schools I've already mentioned, and the facility come with the squat plates, water closet. We have hand washing facilities, water storage facilities, and then water shed and bins to manage their solid waste as well. We also added training component to it to change behavior and then also improve sanitation practices in the various schools. So we have a 1-year coaching and mentoring activity with the schools to make sure that this facility that we have provided will be taken care of, and then the O&M will also improve. Challenges that we faced throughout this period, we realized that affordability was a major constraint. Low urban income communities. Some people want toilets, but the prices they cannot afford, and they are not also willing to borrow to access toilet facility. We did a study, and most of them say they want the toilet, but they are scared to take a loan. They will not be able to pay, and they will harass them and all that. So realize that was a big constraint when it comes to provision of household toilets. And then the weak private sector. It was difficult to get small-scale toilet SBIs who can access funds from banks or even communities to provide this facility. So we needed to build the private sector capacity to be able to deliver to the communities. And then also lack of suitable toilet options for these low-income communities. In the Greater Accra metropolitan area, their bylaws or the city laws do not accept KVIP. And therefore, the spaces we have also, they cannot construct septic tanks. So most of the people rely on public toilets just because of these challenges that they were facing. The demand for household toilets was initially high, but when we registered the people, they will register they want toilets, but they will not come forward for it. The key lessons we have learned is we have to respond to the realities. People in these communities cannot afford the current prices of toilets in Ghana. Therefore, we need to come up with incentives to support them to own a dignified or appropriate toilet technology to suit their environment, especially those with high water table and all that. And then also simplified and affordable technology is an option we have to explore more for these communities. And also inclusiveness. We have to integrate gender mainstreaming in our designs, all our programs, especially the vulnerable populations, and then also the operation and maintenance of their facilities, even when we give it to them for free. Then the provision of water supply cannot use the normal system. We have to use the low-income consumer support, where we go to the doorstep of the people to engage them and give them the service, because they feel they cannot come to us and access water supply to these low-income communities. And then also the urban settlement, the informal, we have to do resilient and integrated wash projects in these communities. And we need all stakeholders to embrace this radical shift in an urban sanitation practices, especially in the vulnerable communities or vulnerable populations. And lastly, we need to embed sanitation within urban governance. We cannot put sanitation alone in one basket. We have to link it to our water supply, our drainage, solid waste, and more importantly, affordable housing, which it will improve the lives of these people in totality. In conclusion, I would say that we need to prioritize human rights of all to sanitation, focusing on informal settlements and vulnerable populations in our various cities. Thank you very much.
Thank you very, very, very much, Charlotte. That was very, very comprehensive. I think in some sense it gives a really good overview and capture of the different interventions in Ghana as a response to the health and sanitation issues. For the other speakers, I will just admonish you to try and keep to time because we've got a very short time frame to cover a lot of things. I'm going to open it up and ask from Richard to come in very briefly and give his sense, if you like, of based on his work in this same space in Ghana and obviously being involved with RECIRCULATE and Actuate. What is your perspective on the subject matter? Richard, please.
Thank you, Akan, for giving me the opportunity. I think Charlotte had said it all. She has explained every aspect of the problems, what they have done and all. And picking up from where she has left, especially within the slum communities, where they don't even have space to even build the toilet facilities for them. And even the cost of those toilet facilities, the cost is very high, so they cannot even afford. So as a research institute from Institute of Industrial Research, we have looked at what opportunities can we get in that area to solve that problem. So we actually came out with a mobile toilet that we have designed using local material. Yes, we use purely local material to design a mobile toilet because those people in those communities don't have space. So with those mobile toilets, you can actually fit those mobile toilets into any available space for them to use. And one of the innovations that we have added to those toilets is that we have incorporated a biodigester into those toilets. So it means that the waste treatment will be more efficient, and then you even manage space because the digester is positioned under the mobile toilet. So the business opportunity is what? We have to train people who can build those toilets at affordable cost, which they can actually sell within those communities to people who can afford it. So it means that we are solving the problem of this sanitation issue in terms of toilets, at the same time creating some business for artisans who will go into that and then be able to make some money. Then, so which is very important. And one thing you have to realize too is that if we all know that waste is resource, and that resource can be used to get money and can be turned into other products, then people will now see that the waste in the community, how innovatively can we use that waste to do other things? So that will also create an opportunity. If you look at the slums, even picking waste from the slum is very difficult because of the way they build their houses. So what do? Do we come out with a small version of trucks that can go within the community to pick that waste and send it for a treatment facility? So that can create another job for people. Because we have artisans, we build all sort of engineering things. Now we have the tricycles. Can we build something smaller than the tricycle at the back that can go within the community and pick some of these waste from these facilities?
Richard,
so this for thought.
I mean, I can almost imagine the human, I mean, permit me to use this, almost like the human fecal waste business supply chain in some sense. Because the opportunities, obviously, based on what you're saying, are obviously there. If I may, I'd like to throw it open to folks in the room. And I want to do that by getting us to engage in like a very interactive, quick activity. So if you all look at your chat session, okay? So the chat section of the forum, there's actually a link. It's a Mentimeter link. So the first question that the link is asking is, obviously, Charlotte and Richard have given us a sense of the waste the health and sanitation issues in Ghana. But I want to get a sense of the room whether this is peculiar only in Ghana. But I would imagine that might be the case across the other African countries, and I'm aware that there are many folks from other countries. So the first question really is, what is the biggest challenge in your jurisdiction, in your country, facing the African health and sanitation sector? So in one word or one phrase, if you click on the Mentimeter link on the chat section, it should open up a page and you will see the question there. All you need to do is just write a phrase, a word in response to the question. In your jurisdiction, in your geographical location, in your country, in your experience, what do you think is the biggest challenge facing the Africa's health and sanitation sector? Let's go. Let's see if we can get some people to kind of engage on this quickly before we go to the next question. Okay, somebody says government policies. There's clean water, so the lack of clean water or the presence thereof. We've got awareness issues. Interesting. Somebody says poor attitude. That's interesting. Okay. There is affordable technology. That's very, very interesting. Okay. There's responses around obviously government policies, healthcare financing, poor attitude. Let me see, what else are we people having? Inadequate water, capital investment. Okay, maybe we'll take some more responses before we come. Education, yes. The training, education, knowledge. Okay, poverty of communities is one of the biggest challenges facing health and sanitation sector in Africa. What else do we have here? Okay, great. So healthcare financing. So it sounds to me, based on the responses so far, that if I may summarize this in some sense, it comes around policy frameworks, funding, knowledge training, infrastructure, awareness creation, and poor attitude. That's fantastic. All this is being captured as important data. Now, this now leads us to the next question. So if you look again at your chat section, there is a second link, okay? And that opens up a new question. And the question is this. So you've identified a series of challenges that faces the African continent. Now, let's try and rank it in a sense. And the question is this. What is the most important and the quickest intervention that would improve sanitation and health? I mean, the quickest intervention. So if you are in a position of authority, or from your perspective, what do you think in terms of ranking will be the quickest intervention right away that can impact the improvement of sanitation? So we have policy, funding, knowledge or training, and awareness creation. So let's see how we do in terms of ranking. For a quick intervention in the health sector, what do you think? So awareness seems to be gaining ground. Let's see. So awareness 7 already. That's interesting. So we have, yes, policy is getting ground. So funding is getting ground. So training seems to be the least at the moment, which I found very interesting. So awareness creation. Okay. Policy. So we keep going. In your view, what do you think is maybe the most important and that can create a quick intervention towards improving sanitation problems? So maybe we'll give you guys another 1 minute. Now we can wrap up this quick interaction engagement. Okay, so yes, somebody made a point that awareness creation could be similar activities as training, which I tend to agree. That's very, very interesting to know. So so I think at this point maybe we can call it off. So it's obviously clear to me that awareness creation seems to be what people think is probably the quickest intervention that can improve sanitation quite quickly. If I can come back to Richard and also to Charlotte very quickly, in your perspective, in your view, do you reckon that this probably is the case? So is awareness creation, in your view, a really good and quick intervention to improve sanitation problems? So first, Charlotte, what do you think? What's your view based on people's responses? Charlotte.
Yeah. Yes, I agree perfectly. Because when we started the project, we thought the challenge was the infrastructure. Okay. So we designed the project in such a way that we're just going to build toilets in homes. Okay. And we funded for like 2 years. If you go to the people and you even want to construct the toilet for free, they were not signing up to it.
Even it's for free. That's interesting.
Yeah. And we have signed up we did registration. We use the Kobo to register people at the household level with landlords, with tenants, and we have 20,000 people sign up.
After the awareness creation, after the engagement?
No, before the awareness creation.
Okay.
It's a ministry. So the district assembly set up to people's home. We have a project to give toilets in homes. Would you like to take one? They say yes. We take number of households and all that into perspective. But 2 years, when we have put SPIs there, people were not taking the toilets. So we have to go back to the drawing board and take consultants to design communication strategies, do community engagement, go to every radio station, every TV station, design it in local languages, come up with T-shirts and all that. For 2 years before it became a household name. So Gamma is like a household name in Accra now.
So
you mentioned
a brand around it.
Exactly.
People can connect to. That's very interesting.
And that's how come we're able to get the numbers. So awareness creation is very, very critical. You need to get the people to understand why they should have household toilets. So then when they sign up to it, they can use it.
So Richard, what's your view? Is your view the same? I would imagine so, because obviously there's this disconnect between doing a really good research and a really good project. If you're not engaging with the folks who will use the project at the point of the conceptualization, what is the impact on the delivery and success of the project? Richard, quickly.
Yeah, I think I agree to a larger extent with her submission. I think that is why RECIRCULATE is one of the projects which is designed and different from the other projects that we have run, because the project is co-designed with the community, and then we engage the community from the very beginning of the project. We let them know exactly what we are coming to do. They participate in all the problems that they have in the community. And then we find the solutions together. So the moment we come out with whatever we wanted to implement in the community, it is accepted.
The response already.
Even before
that's absolutely fantastic.
Yes.
Okay, now I think we can move. That's actually really, really powerful. I think we're going to come back to this later on. But I think we can move to the next section, which is actually maybe getting the next speaker to give us a Nigerian case study, a different perspective view. Now, the person I want to call is Dr. Noimot Balogun. She's a health strategist with expertise in health intervention design, research engagement, and stakeholder relations. She's the project lead of Linka.ng, a health relationship company that interfaces between health systems and the people they serve. So I think in some sense, what we are speaking about in this Ghana element, and obviously the interaction by everybody in the group, I think Noimot can give some kind of credence to that. Now, she's a member of the Health Policy Commission of the National Economic Summit Group in Nigeria, and she's also an adjunct research fellow in the health and communications at the Nigerian Institute of Medical Research. Now, Dr. Noimot Balogun will be speaking a perspective around health intervention design with communities. Over to you, Noimot.
Yeah. Okay, so what is community design thinking? Thank you very much. I think the earlier speaker did a very good job in mentioning the different challenges that can come up with communities. Now, for design thinking, it's all about, now the first slide, please, Alan. Design thinking is all about the idea of developing non-linear innovations with the assumptions that you're developing this for the beneficiaries. So you're already putting in their assumptions, the myth, their fears, their beliefs, their choices, the different things that define them, their perception. You're putting everything into consideration before even beginning the research or intervention, as the case may be. So community design thinking, the next slide, please. So community design thinking looks at the conversation amongst the people. What do they talk about? Looks at the assumption, amongst them. What is it that they assume? Looks at the norm, the myth, the beliefs, the choices, the perception, and their access to information. Where do they get their information from? And how ready are they to getting information? So now the thing there is, if people's access to information is not from social media, why do you think that they're going to get your own intervention that you have put on social media as the main linkage to dissemination? So many times when I see researchers, investigators, or intervention personnel talking about the need. Oh, you know, there are a lot of people on Twitter, there are a lot of people on Facebook. We're going to get it there. You should need to start, you know, analyzing your audience. If your audience is more on radio, no matter how much or how good the campaign is, it's not going to get to them. So the design thinking would look at the different conversations, the assumptions. It would look at, you know, the myth and all of that. So next slide, please. So now in doing this thinking, you're looking at the investigator or the person doing the intervention is immersed into the people, into what they think of. So let me take you back to what we used to know as Barney. Remember, if for us that, you know, have kids that watch cartoon, Barney is one cartoon that a lot of times the children just imagine. They put themselves into that same situation, and then it's easier for them to engage themselves. So you need to first immerse yourself into that situation. What would I do if I were to be this community member? You're not going to be coming under design thinking. You're not coming from the point of, oh, I'm going to do this for these people, which was one of the things that Charlotte mentioned, that, you know, that was one of the challenges that they did see. And that was one of the things that they were able to sort out, you know, because you need to immerse yourself into it and ask yourself, what would I do if I were to be this community member? And that is not going to inform your idea. So you have already immersed yourself, and part of immersing yourself into the community is doing a simple research, like an ethnographic research. Get someone to live inside that community for like a month. If you see all those journalists that want to write documentaries about people in the Middle East, about people in different Asian countries, they go there, they live there. In fact, some of them begin to learn the language. It's simply because they want to get a job, they want to do the job that would inform the practices of the people. So ethnographic research is one of the things that we need to start putting into consideration going forward. There has to be that sense of you living inside this community, see their natural lifestyle, what they believe, what they love talking about, their conversations, their assumptions before you ideate. And then, of course, after the ideation, then you need to define and then test that solution. Whatever it is that you're bringing on board, test it to be sure that, oh, it wasn't an assumption on your own part. So the testing that the sanitation project was supposed to do in Ghana was what now happened 2 years after. So they had eventually, after 2 years, eventually now immersed themselves in inside that situation, and then realized that awareness creation was one thing that they left out. And then they now went back to prototype it, and it worked. Next slide, please. And so in a nutshell, we are looking at health environment as the, you know, case studies here, but we need to understand that in immersion, you have to look at the support system. The support system where those people are going to be influencers in whatever it is you're doing. So we look at support system in terms of Ministry of Finance and Budget, Ministry of Agriculture, in terms of Ministry of Legal, you know, legal affairs, because some of these things may take a legal route. So it may also, you know, involve the law enforcement. So you need to look at all these people when you are developing a design thinking for community interventions. Next slide, please. So now quickly, I think basically I've been able to talk about design thinking and the many innovations that are local based that we can, you know, bring on board. So now using the COVID example in Nigeria as a case study, what was it that was done? What worked? What didn't work? So using the COVID example, so COVID came in when someone that's, I think an Italian, you know, came into Nigeria, and then before they found out, he had already gone to like 2 places. So when they were going to start the intervention for COVID now, what happened was mainly contact tracing, you had the testing, you had the creation of isolation centers, lockdown. The government, that's Ministry of Environment, were fumigating the marketplaces, and then there was enforcement on lockdown. Those were the first set of things that were done. What was the impact of this? Now, people were going to be in lockdown for 2 weeks or 3 weeks. It was extended. And we didn't think about risk communication. This was the time when we could have, we could have engaged them. They were not going out anyway. So talking about the things we can do in design thinking in this situation, imagine if we had a risk communication that was right at the beginning of this intervention, where you have jingles, you have skits done on, the public address system. The people were in their different homes. So imagine if we had community health workers going on with their public address system, talking about COVID and talking about the safety measures and things. The people were at home, so they were going to listen anyway. So we didn't do that until later on. Risk communication came into COVID response around April, which was like a month, 2 months after it had already gotten into Nigeria. Then secondly, one area of communication that was done the most is text message. I mean, I still receive text messages up till now. But then if you took a poll of 100 Nigerians and ask them how many people read these text messages, you probably get like 5 or 10. Why? Because it became an everyday affair. It became a routine and people got tired. Now, these were people shouting and talking about palliatives, and rather what they were getting were text messages. Now, another thing that also came up was the safety measures. We had the hand washing song. So one of the things that came up was hand washing. Oh, you're going to wash your hands for 20 seconds, 30 seconds, and then you read ABC. Now, the question is, how many adults read A, B, C, D on a normal day? A lot of them would rather read, sing their religious songs. So if I were to say this as a Muslim, I would rather you just tell me one religious song that I'm used to singing anyway, or chanting, and because I do that every day, use that to tell me to wash my hands. And if it is the Christendom, you can imagine you having to sing, let me try and think of one Christian song now, where you can imagine, I'm trying to think of one that's, you can imagine somebody singing every living soul, praise the Lord. And the person, this will come naturally. So they're washing their hands and they are singing their song. And it's a living soul anyway. So they are praising their Lord. This will come naturally. Instead of you telling an adult male or female to sing A, B, C, D, it is for children. So we need to make some of these interventions to come seamless, to come like naturally to people, so that adoption is easier. And then another thing was the face mask. Remember the many issues that came with the face mask, the many videos of it's compulsory, it's not compulsory, it's this, it's that. And then lastly, we also have that of palliatives. We all know what happened with the palliatives during the EndSARS protest. Imagine if these palliatives came almost at the same time when the people that were doing contact tracing and community mobilization were going into the communities. So you could look at some of the artisan associations that couldn't even open their shops and give them some of those palliatives as a way of boosting their businesses. What I'm saying is that if you're going to have an intervention, it should come into the natural challenges of people. They couldn't leave home, so they needed food. These palliatives were locked somewhere, and eventually people found out, and it became a big issue. And a lot of people lost trust about the governance around COVID. Next slide, please. I'm almost done. So another part of it, which is about the last part, is also the public-private participation. There was so much money brought in through the presidential task force. But then a lot of the same money were taken to the states, and it was used for more isolation centers, more contact tracing and all. But then imagine what would have happened if we had community-driven disciplines. Remember that they fumigated the market. I think it was done twice. Imagine if we had environmental health officers who go to these communities every day anyway, have some of these budgets such that they go in and enforce that many of these communities clean their environments. These people go into the community, that is what they trained to do. Imagine if we had these community health workers who would do a proactive risk communication and tell them about the many issues and updates of COVID. Imagine if you had reward and recognition. That would mean that any street or any market or any house that is able to do proper hand washing, they can take a picture of themselves and post it and it is shown on a Lagos State, on a Lagos State television, or it is shown, or it is mentioned on radio, trust me, Nigerians are people that like competition. If you show the house, in 10 minutes, you will see like 10 houses submitting their own entries. So we could buy into the psychology of people in terms of competition to be able to get them to do what you want. I also talked about the religious part of it. Imagine if all these health safety measures, or if you add a church or a mosque, an Arabic center, a mosque, a Sunday school, doing the social distancing, doing the face masking, and they show them or talk about them or mention them as people that are compliant on radio or on TV. The other mosques and the other churches would follow suit. It is about competition. And then school health. Imagine if you had one of the schools shown to be fully compliant, the other schools will follow. So those are the different interventions that we can take in when we're looking at the community interventions in a way that will be sustainable. And lastly, of course, we all know that a lot of people in the communities took a lot of things: turmeric, ginger, dongoyaro leaves, black seed oil. Are we even thinking of making research in this area? Are we even thinking of looking at the herbs and see what actually made the incidences of COVID-19 to be relatively low in Africa compared to European countries and US? We need to start thinking of those community-driven research. And as a wrap, I'm done now. As a wrap, design thinking is about immersion into the lives of the consumer, because this is what is going to encourage sustainability and true partnership, co-creation, and collaboration. You're not going to be talking about design thinking when it is coming from you. When you think that you are doing the people a favor, when you think that you are the one that has an idea of what they need, because these are the people that are going to need them anyway. They are the consumers. Whether they are paying for it, whether they are not paying for it, you need to be able to understand what makes them tick. You need to be able to understand their natural lifestyle and what it is that they would naturally ease into. And that is not what you would use to develop their different interventions. So as a wrap, maybe risk communication should be the opening process of every intervention rather than an afterthought. Remember, for you to turn a research intervention into practice, it is all about relationships. So I leave you with this question: what relationship are you keeping with the beneficiaries of your interventions? In terms of health financing mechanism, a lot of people talk about the HMOs and the fact that people in the communities are not easing into health insurance. They don't see it as need. But then we have the thrift collectors that collect money from them in the different markets anyway. Can we begin to use this natural community-driven natures or community-driven actions and activities and develop interventions around them? The radio programs have natural programs that have a high listenership. Can we key our health interventions into them instead of a standalone health talk or health program? What will work is what is going to engage the people, and engagement of the people is all about relationships. Relationships is what drives sustainability, and sustainability is what assures adoption. Thank you very much. I'm done.
Thank you very much, Doc. That's fantastic. Absolutely appreciate that. So I think, so as you were speaking there, an idea came to me, which I think we'll talk about at the point of an engagement. But I think for now, because of time, I think I prefer to move to the next speaker, because ultimately, you almost cannot, especially from an African perspective, you almost cannot do any sustainable research that has got potential impact on communities without your understanding of gender dimensions. And so we have on the panel, Professor Carolyn Thoruwa. She's a chair of the African Women in Science and Engineering. She's a professor of organic chemistry at Kenyatta University in Kenya. She holds a PhD in pharmacognosy at the UCL School of Pharmacy, University of London, Master's in Science in Chemistry from Kenyatta University in Kenya. She's also the Secretary General of the International Network of Women Engineers and Scientists in West, and as well as the Director of the African Center for Transformational and Inclusive Leadership, ACTIL. And so Professor Carolyn Thoruwa will give us a sense of the gender dimension around health and sanitation management in Africa. Over to you, Prof.
Thank you very much for inviting me today. It's a pleasure to be here this afternoon. So basically, I'm going to speak on gender and health management and outline the issues in work and sanitation, gender mainstreaming, and recommendations. We're all aware of SDG 6, and water is very valuable to all of us. And I want to gender lens. And of course, we know SDG 5 is the SDG 5 is about achieving and how all women and girls. And 5 and 6 are actually connected through 6.2 and energy for all activities and end openification, paying special attention to the needs of women and girls and those in vulnerable situations. We just want to look at water and sanitation through the and we're all aware that women are the primary users and providers and managers of water in our households, and they have a larger role compared to men in terms of water, sanitation, and hygiene activities, and even in agriculture and other places. So it's short of water, women are actually the ones who are most affected. And so this has implications for gender equality. So I want to look at some of the issues that affect women in this area as well. The first one is women and girls' water fetching burden. We all know that women travel to get water depending on where they stay, and that has implications for wealth and economic well-being. This was a study that was done in Sierra Leone, which showed that women can spend more than 1 hour, and even up to 3 or 4 hours a day fetching water. And in the second diagram here, just showing that the real burden carrying water really falls on women. And then this is followed by men, girls, and boys. So water has been women. This would be the ideal situation. They had to travel so many kilometers. Great to see men and women.
Prof. Caroline, could you go off
Yes?
video? Could you go off video if it will help with the network? We're really struggling with your network.
Oh, go off video.
Yes, could you go off video if that will help with the network, please?
Yes, so what we're saying is as women carry water, there are also health implications. I think the slide for that, and it affects their slides. Basically, in terms, there are several issues, and the second one would be lack of sanitation resulting in gender-based violence, which is, and mental stress. And this is as a result of either lack of sanitation and toilets or inadequate toilets. And so women will walk long distances to use toilets, or will actually go to shared facilities, and they can actually face, they can be attacked, they can face gender-based violence. And so women are affected by, they have fear and they are really uncomfortable. And sometimes women will, may not eat or drink so that they don't have to use external facilities, and that has health implications. And so basically, lack of sanitations or poor sanitations will tend to create stress, mental stress for those who are concerned. And also there have been many issues of gender-based violence. Next slide, please. Yes. A third issue is women's unaddressed unique needs for water and sanitation. Many times women have needs for hydration, sanitation, and hygiene, during menstruation, pregnancy, while they're doing childcare, and this has implications for women and their health and their safety. It also has implications for girls' menstrual management and emotional well-being. So when these are not met, women are not able to participate equally in society. Next slide, please. And also the issue of girls going to school. We know that when they don't have enough adequate toilets and facilities, then they may decide not to go to school. They may drop out of school. This is, well documented. And so basically it's very important to ensure that women have adequate water at special times in their lives. Next slide, please. Next slide, yes. The fourth issue that I look at now is just lack of women's participation in decision-making and governance. And as we know, because women are the ones who have a lot of, who have the main access to water resources, especially in the homes, they have accumulated knowledge. And they know lots about knowledge, their storage methods, they have lots of insights on hygiene and sanitation, and lots of information that would be important information for policies and programming. But we find most of the time they're not included in the planning, in the monitoring, evaluation. And that's because they have less power, resources, and status than their male peers. Next slide, please. Yeah, this just shows how women sometimes are just left doing all the tasks. We say women are, next slide please, women are too busy carrying water. Next slide, to be involved. Women, are they too busy to discuss water? Next slide please. And women's lack of participation. And another thing we recognize, of course, is that many times women are not involved in decision-making when new technologies come, and therefore they may not be quite appropriate. And so this can be addressed through gender mainstreaming. Next slide, please. Gender mainstreaming, which basically where we are assessing the implications of programs and projects and policies for men, women, girls, and even considering their concerns and experiences. And so the idea really is just to ensure that men and women benefit equally and are not, and gender equality is achieved. Next slide. And next slide. And yeah, recommendations is that these programs, whatever programs we have, should always have a gender mainstreaming aspect to it. I know Work Package 2 has a very good social program. I see that they're taking into consideration all the roles of women and girls. So I can see that's already really taken into consideration. But when it comes to water and sanitation, we need to consider aspects of distance and their impact on women and girls, consider security issues. Women are usually scared when they have to go and use external toilets, of course, issues of gender-based violence, and of course, the issue of improving public toilets, ensuring that both boys and girls are change agents, and we need to involve more women in decision-making and governance programs. Thank you.
Thank you very much. So that's absolutely fantastic, Prof. And I apologize for the network to everybody listening. I'm sure that we got through that. And I think in some sense, what we've just done is covered two specific important areas around design thinking by Dr. Noimot Balogun, and also Prof has just highlighted the importance of gender mainstreaming, or the perspective of gender with respect to health and sanitation management. Just like I did it last time, I'd like to engage everybody again on a very simple activity. So if you go to your chat section quickly, so while Noimot was talking, obviously before the webinar today, she had obviously highlighted the fact that she would specifically deal with COVID as a case study. And ultimately and globally, we all know that the basic, if you like, the basic traditional, the basic requirement for as an intervention for the prevention of COVID being spread, it's wearing of mask, washing of hands, and social distancing. So we're just thinking about, well, now, in terms of people's responses and they are complying with these in jurisdictions, let's have a sense of, because ultimately, about design thinking, what is the potential of people's responses or their situations or local conditions to their response to interventions? And so if you go to the chat section, there is a Mentimeter link, and the question is very simple. The question is, so in your view, during the community intervention of a virus situation, like as it was in COVID, okay, which of these was the most complied with? So people can just respond to. So which of them was the most complied with? As a very simple activity. So wearing of mask, okay. Interesting. So wearing of mask is stopping, and I really wonder why. Maybe somebody can give us a sense why this was the most complied with. Okay, so washing of hands. Okay. Yes, go on, please. Go on, go on. Let's keep going. Let's keep going. Okay. Okay. Can anybody in the room tell us, in some sense, why they think the wearing of masks was the most complied with? Why is that? Why is that the case in your view? Anybody has a response to that? Anybody at all? It's fine.
Okay, I think it's because of the policies that were put out there. So for instance, if you are entering my office and you are not wearing masks, you will not enter. You are entering the shop, you are not wearing, you will not enter.
Okay.
So,
is that because that's the visible nature of wearing mask?
Exactly.
I mean, if you wash your hands or don't wash your hands, who is going to know anyway? Yeah. Okay. So I think we can move to the next question, which is a question that Professor Karen actually posed. And the question is very simple yes or no question, but just for us to get a perspective view. So, and the question is, inadequate water and sanitation in a community can lead to gender-based violence and mental distress. True or false? What do people think? It's a very simple question, but I think I probably know why she asked it. Okay, I think just to get folks to engage. So inadequate water and sanitation in a community can lead to gender-based violence and mental distress. True or false? So there seems to be no false yet. So that's a good thing. Well, I think, Prof, is that a good thing then? Is that a good thing? There seems to be no false.
Yes.
So that's good. So that means people are engaging. So maybe we could just move to the next question. Next question, okay? And this is the last question for the day before we'll go to the final session of the webinar, so we can wrap up. Second question is this. Gender mainstreaming is concerned only with integrating perspectives and realities of female population groups only. True or false? Gender mainstreaming is concerned only with integrating perspectives and realities of female population groups only. True or false? So there is 9 false. We have one. There is 1 true for now. 17 false, 18 false. So, Prof, could you give us a sense as to why you think that is false? Because you told me before the webinar that it's obviously false. But what actually is the premise why considering gender mainstreaming shouldn't be just the realities of female groups alone? Why, Prof? Quickly. You're mute. You're mute.
Actually, the thing is, gender mainstreaming takes the concerns of the whole population: women, men, girls, boys, different age groups, different situations, the disabled and whatnot. So we want everybody to be considered to have equal opportunities and their issues and problems solved. So basically, it involves everyone.
Everybody. That's fantastic.
Yes.
Thank you very much. That's really good. Thanks everybody for engaging with this so far. Don't worry, we're about to wrap this up.
Akwaah-Adjei, can I quickly say something?
Yes, please, Doc. Go on, please.
Last question that you asked concerning the face mask, like
Yes,
somebody did mention. Yes. So there's this community enforcement around it.
Okay.
Anywhere you want to go to, if you want to enter the fast food joint, if you want to enter a public agency, if you want anywhere, even if you are now going to enter and then remove the mask, it looks as if you're going to enter any mall, you need to be able to use the mask. So eventually, it also shows that enforcement sometimes is also should be part of our design thinking. Now, the enforcement now may not come from the police, like probably looking at it from the higher ranking, but maybe something as simple as getting youth,
Okay, that's fantastic. Okay, so I'm going to call on Dr. Manoj Roy, who is actually one of the leads on the work package to health and sanitation of the Actuate and the RECIRCULATE project. His research interests include urban poverty analysis, ecosystem services and the services. Is an expert around urban poverty linkages, climate change adaptation. He's a international multi-award winning researcher, who has won awards from different bodies, including ESPA, NERC, DFID, and a whole lot. And his research countries and expertise is focusing around Bangladesh, India, Ethiopia, and Tanzania, and recently Nigeria, Ghana, and other African countries. I want to call on Manoj Roy to give us a sense of the basis or the premise around partnership and collaboration in this potentially winnable battle of water provision for all. Over to you, Manoj.
Thank you, Akan, and the audience. Let me just bring my screen. Can you see the slide all right? Okay, brilliant. I think Akan has been very generous in introducing, but I was really listening to very elaborate presentation, sort of really giving us a solid backdrop, just for me not to go back to this, background and contextual issues again. But however, I think Akan also really told a nice word, is that to answer to this big question of can Africa improve its health and sanitation. So in our research viewpoint, it is a winnable battle, but it has to win. It is a battle. And through our research, I will just present some very recent findings just to say that why we think that the winnable battle has to be in the last 100 meters of drinking water provisioning. That is the key word we'll be taking forward, that the last 100 meters phenomena. We'll be showing why this is so important. Let me just first begin by saying that the battle that we have been talking, and other colleagues are also talking, is in fact two sides of a coin. So, first side is that a recognition of that there is or has been and will be a rising gap between the provision of piped water and the growing urban population. And that was quite vivid in Charlotte's presentation. So we do not necessarily all the time talk about water when we talk about sanitation, but at the same time, also, we do not necessarily talk about sanitation when you actually talk about the water. That's one of the critical problem. And that's why the second side of that coin is that there is a corresponding rise in unsafely managed fecal waste being released to the local environment. So on the one hand, we're failing to reach many population with water services, and to complicate matter, we are also failing to safely manage the fecal waste that is produced in those informal low-income settlements. These statistics that you are seeing is from two very recent publications that is really showing that sub-Saharan Africa is lagging behind on piped water supplied on premise. So you can see the 2015 figure, 114 million versus 231 million, and you can safely assume that low-income communities that we are talking will be belonging to this 231 million. But more importantly, see the 2050 length of population. And you can imagine the challenge lying ahead. Closing the gap, but also expanding it substantially. The similar picture also on the sanitation side, you can also see that unsafely managed is 58%, and according to Charlotte's admission, it is just hanging over 20% or so. And if you imagine that is the expansion of population, just imagine how much speedy an expansion and catching up to do. So these two problems are two sides of a coin. And so far, even Charlotte mentioned at the last conclusion, is that this problem is not part of the urban governance. So there is the big problem we are facing. So that's the battle we are talking. Now, question is that where can it be winnable? So as I have introduced this last 100 meter as a concept, let us just understand first what actually does this term mean. Okay, so all colleagues who have been doing research in Africa or from Africa would probably understand the situation that's being presented here. On your left, you can see a lady has come up with a bucket to fetch some water. You can see a tap of this post that is coming from municipality pipe service. So it is not going into her home. She's coming to a central shared collection point. And then the red dotted line is showing where her home is. She will be probably walking, who knows, 20 meters, 50 meters at best around. That's her home is. So that's where she will be taking the water, walking, carrying him herself, and often not putting a lead on. Maybe someone, as Professor was showing, carry on the head, or open top. But anyway, going inside home, she will probably store also, some maybe compromised position, probably on the ground without a bucket, lid, or many different ways. But significantly, if you can see another arrow on your right, is the centerpiece is a toilet, is a shared toilet. And more importantly, there is a pipe proudly coming out on its left side. You can see that is an overflow of fecal material. It is never that these toilets are, emptied. People wait for the rainy season to let it go. The fecal material, you can see the color of the surrounding land is showing how much fecal material has been poured into the environment. Again, it doesn't really need much imagination that kids are walking barefooted. Livestock, chickens, ducks are walking. Millions of cockroaches comes out at night and carry all these things back to her home into the water. So this is what we're actually saying, that these spaces where people managed water provisioning is actually the last 100 meter of drinking water supply. Why you are saying this one? Because nobody is coming to take the responsibility of the integrity from the water point to the home. Nobody is actually mixing up with the water provisioning with the sanitation. So there is tremendous amount of work going on only sanitation, or tremendous amount of work going on only water. Nobody is really thinking this as a collective. But in an environment, everyone is showing is that drinking water gets contaminated really on this final leg, final last 100 meters. And we'll show proof of that happening from our research in RECIRCULATE. Okay, so next problem, diagram is actually taking that diagram into sort of a little bit of a mesoscale, settlement level. You can see a dotted rectangle or squarish rectangle is actually showing the physical extent of a low-income settlement. And how does the water come? So let's just focus on it. So water comes from a main supply point. It enters into the community through the feeder distribution network. And then people actually, put this into overhead tank, sometimes on standpipe. That's where people come and collect the water from. And the lady is actually exactly doing so, and she's going to that to her home. And along this side, there are different ways or different sort of gateways for fecal material first being released in the environment from poor quality sanitation, poor quality toilets, then getting into the water that she is carrying. And now let us just bring this particular situation in the context of Accra, Ghana, where we have been doing this research. And then we are actually defining separate up to 5 what we call water journey stages, whereby water comes from the supply main to the people's home. So you can see on your very left, we are calling it as a water journey stage 1. That's where the main pump where water comes either from surface water or from groundwater. It is treated, it goes to the overhead tank, the main tank. And the next it comes through the different pipes to the feeder pipeline to the community that we are mentioning. Okay, dotted line, remember it for some clarity. And that is, this line is our water sanitation 2. It is likely that some contamination might happen from the main supply to the entry point of the community. So that is one source that might be attributable to the problematic water network. Then comes what happens from the feeder to the inside the shared standpipe inside the community. The picture that you just seen, the lady was waiting to collect water from. That is what we are calling as the water journey stage 3. So there is likelihood and probably increased likelihood of water getting contaminated by the fecal material from water journey stage 2 to 3. It is very likely because the water piping is done in this community by local masons who probably do not have the utmost scientific knowledge. Sometimes government officials do lay out the pipes. Subsequent maintenance is done by probably the local masons. So there is a lot of ways for this integrity could be compromised. Then comes, as you have seen, that overhead tank. People do take water from the pipe that comes into the community within an overhead tank, and that's where on-selling of water happens, meaning that one person has a big tank, filling up the tank and selling to her neighbor or to their neighbors. That is our water journey stage 4. Up to this point, up to water journey stage 4, you can attribute these water quality to distribution network. But municipality usually claim their ownership up to water point journey stage 2. 3 and 4 are locally laid, locally owned networks, so to say. So there is, of course, potential for the water getting contaminated here. And finally, water leaves the network and into people's buckets and enters into people's home. And in Accra, we also found that not only are people getting water from the network in the container, but they also buy the sachet water. That is actually is not coming from the network, but it is supplied. It's a commercially provided packet packed in polythene bags. So these are, in a nutshell, our 5 water journey stages we can see. So we wanted to prove along this journey stage where and how much of fecal contamination is going into the water. And I think the community that we are talking to is fully aware that fecal contamination is lethal, okay? Akan has told in the very first comments is how many diarrheas, death, and other forms of death are happening. So we are actually taking it for granted is the presence of a single fecal coliform, colony forming count can be lethal, okay? So that's where we are actually concentrating to see whether this contamination is there, and if so, where is it taking place? And that might give where we might be able to win the battle, okay? So here is the result, almost hot off the press, you may say. So this is the result, how we have actually discovered the last 100-meter phenomenon in Accra. So you can see that we can sort of, horizontal line is our water journey stages. And the vertical axis is our fecal coliform count. And you can see very nicely that from water journey stage 1 to water journey stage 3 or 4, we surprisingly found the water quality was very good. So great job done by the municipality of bringing this water to the community safe. But then what happens? Within the last 25 meters on average, what happens do you see? You see a significant rise of fecal material in the water. So safe water is getting contaminated in the very, very last few meters of the water formation inside the communities. It's very easy now to blame people. It is very easy to say that these people are not really managing safely their own consumption. They are not practicing hygiene. They should all know. But this attribution is problematic. This attribution is problematic because there is problem. So there are many questions one could ask. I just wanted to sort of leave a couple of very complicated concepts, but which we may come probably in a separate time. So one is that chief commercialization, particularly in, I can say in Ghana, whereby you can see that the public toilets is being accessed or being managed in a very dire condition. And the price has brought down to a very bare minimum. And with that price, no one is going to be able to keep up the sanitation facilities. So safe sanitation with that price is almost impossible. So we have to sort of really ask the question, where did it happen? Even if we do free, what happens? So that's another thing. And the second is even more problematic concept, perhaps, is a trend of status quo denialism. It's a mouthful of concept. What are saying that, as you have seen many programs, that they actually do not appreciate or not even acknowledge the presence of toilets in a current condition. Even WHO does not allow toilets to be shared in the name of safe sanitation. And even if you see the Gamma project in Accra was not actually improving or managing the existing stock of toilets. Existing stock of toilet in all policy document is considered to be unsupportable, unmanageable. So there is this problem of status quo denialism, meaning that people have already built toilet, but we do not really appreciate that stock. So we are actually coming from a different angle. What happens if we actually do not build new toilet, but can we manage the existing stock? That means to give people, an upliftment or some way of really helping them to manage existing toilet better. And that's what we're actually implementing in this project as an intervention, which I am not going to deeply inside, but I just wanted to sort of take you to some of the stuff that we're doing really on the first final penultimate slide, is that in the RECIRCULATE and Actuate project, we are developing a way of tackling this challenge that you have just mentioned, happening on the last 100 meters, really on the final one. So what we are trying to do is that we have partnered with a anaerobic digester treatment SME, is called SGL, and we have also partnered with Professor Kirk Temple has already told us how to treat this fecal material, but also more importantly, why do you take this fecal material treated stuff, possible agriculture? So we have also developed a partnership with called Blue Sky, whereby when we actually do treat this material, then we take to apply in the agricultural field. And we are taking the toilets that exist in this community. So we are actually preventing this status quo denialism. Rather, we're making it visible, entirely visible, meaning that we'll take the toilet material from those study areas and take it to SGL. We'll actually do the digestion, measure the energy output, as well as they take the digester to the agricultural plot. Again, measure the contribution in the agricultural piloting. So what does it then give us? So we can see that this is not a one-way journey. So fecal material is being traveling from these very low-income toilets, existing toilets, to this through this channel. Then we can see on the bottom there are some tangible benefits that we can measure, and on the top, but there are higher quantities or higher volume of intangible benefit. Okay. Just to give some idea, Akan and Professor Kirk Temple has already spoken. We're building capacity, and we can see that what we haven't seen in any sanitation project so far being presented in this seminar is thinking as a holistic, but we are actually linking that one. So fecal waste value chain is extended from not only linking to the low-income communities, but going to the SGL and onwards to the agricultural plots. And by doing so, we probably are reducing diarrhea incidents that Akan has said. So there is this healthy environment. And the intangible benefit, as you probably have seen, Professor was mentioning in my previous speaking, is that we are working with the basic school students, school kids, looking into what we are doing, participating in it. They're sort of making fun, but also seeing really how it is being done. But also, very innovatively, we're also engaging the basic communities, one of the intervention committee, adolescent girls, who we are actually coming and taking to the lab to see those water contamination sampling and analysis, so that they can actually see the invisible contamination made visible. So that actually changed their thinking process. So they become the change agents. And these girls then talk to their moms, aunties, younger brothers and sisters, and to the community. We are not going to teach them, but it is those girls who will be teaching them. So those are kind of intangible benefits we are seeing. So I'll be really closing here, where we are now on this research. So as I just presented baseline, we have completed. Intervention ongoing, meaning that working with those kids and the adolescent girls and the industries is ongoing. We should be able to tell you whether the battle is actually winnable by the end of 2021. Thank you very much.
Thank you very, very much, Manoj. It's fantastic. That's really, really powerful. So, I mean, we've had a lot of discussion today and covered many, 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 many areas. I think it makes sense to invite Professor Roger Pickup, who is a professor at the University of Lancaster with interest around environment and human health, with expertise in molecular microbial ecology and environmental microbiology. He's also a lead on the work package 2 of the RECIRCULATE and Actuate project, and he will give us a wrap-up based on today's webinar, and then we can call it a day. But as he does this, if you look at the chat section, there is a link for folks in the room who want to be issued their certificate of attendance and participation by Lancaster on the project. Just click the link on the chat right away and fill in how you want your name to appear on the certificate as Roger wraps up. Over to you, Roger.
Thanks. Can you hear me all right?
Yes, very clearly.
That's good. Excellent. I apologize if my dogs bark or the doorbell rings or anything like that. It's the one, the hazards of working at home. But okay. As Akan said, yeah, I'm a microbiologist and I'm learning really fast in this big RECIRCULATE project and Actuate and all the other projects. And we focus on water. Yeah, it's the quality of the water. And simple people just say, oh, just improve the quality of the water. But what today shows, as we know all the way through, it's far more complex. And just to wrap up this whole talk today, we've covered topics from Manoj has just given us some data from the ground. You know, we've been out there and we've measured, but all the way through this, we need other things. We need awareness. You know, that was in the first talk. We need finance. Finance is a real problem that came out. If we have finance, we might be able to do the interventions. If we do the interventions, we need finance and other factors to keep those interventions sustainable. That includes encouraging the community, getting into the community. If they don't want it, it's not going to happen. And that's one of our key strengths. We have people in the countries where it's needed talking to the communities. And then we looked at the partnerships and the financial partnerships. We have to keep those going, keep those sustained. And then overlying it all, it comes back down to the community. We're talking about gender mainstreaming. Many of us probably wouldn't have thought about that, but that's a key thing. And it's all part of the sustainability of what we try and do. And then we end up back on the ground again. What is the contamination? How is the health? Are we actually improving anything? If we improve the water, does it improve health overall, or just does it make a small contribution? These are the things we don't really know. So, you know, in wrapping up, I can't wrap up because we don't have the answers to all this. We're all working towards it, and we will continue to do so in RECIRCULATE, in Actuate, and hopefully in the projects that will follow. Because I think the strength that we have and this community, and at one point there were, I think, about 55 people participating in this. We have 42 now. We're all potential partners. We can all talk to each other, and we can all start to develop projects, particularly with experts in their own countries. You know, we can help, they can help us. It's all we're a big community now, and we need to sustain ourselves. And I think activities like this really do that. So I'll finish on that. I've no PowerPoint to show, you'll be relieved, and I'll hand back to Akan, who has another activity, I think, as well.
Thank you so much, Roger. And thanks to everybody on the webinar today. It was absolutely insightful, lots of perspective views, and the fact that this problem around health and sanitation also is an opportunity. It's a complex problem, but at least Manoj has wrapped it up with saying that it's actually a winnable battle. So that's encouraging. And obviously, we look forward to more correspondence, more conversations, and more engagement on this Participate with RECIRCULATE project. I think centrally, if you ask me, a key thing that's come out today, and obviously I saw lots of conversations on the chat as we're having this communication. A key thing that's come out to me is the fact that we cannot do this without collaboration, without partnerships. And so on that note, for those who actually want access to certificate of participation, don't forget to click on the link on the chat and fill in a very small questionnaire specifically to give us a sense of how you found the webinar, but also how you want your name to appear on the certificate of participation. On that note, I'd like to leave us with a new video that actually highlights the art and the importance and significance of collaboration. And so have a lovely, lovely week ahead. Thanks, everybody. Video, please. Over 90 million tons of waste is generated in Africa per year and is estimated to reach 160 million tons within 5 years. Over 600 million Africans don't have access to electricity. Over 200 million people experience hunger and are chronically undernourished. Over 100 people die every hour, and over 100,000 children die every year due to poor water. In an era where global concerns about sustainability are peaking, a global sustainability network has never been so crucial. Sustainable development in Africa is seen in a range of challenges which impacts on the environment, economic prosperity, the health and well-being of Africans. These challenges, however, provide huge opportunities to facilitate the co-design, co-development and co-delivery of sustainable initiatives and solutions which directly address the UN Sustainable Development Goals. This can be achieved through collaboration, the development of strategic partnerships, and growing a global network. The Center for Global Eco-Innovation, based at Lancaster University, is at the heart of this expanding network focused on real transformational change.
Eco-innovation needs to be community-driven if we're to develop inclusive solutions where people and planet prosper. Collaboration is the guiding principle for us at the Centre for Global Eco-Innovation. Connection drives innovation, and forging links between industry, government, citizens and researcher is absolutely central to what we do at the Centre. Only by working together in equitable partnerships can we break down the barriers to building a better future.
Universities across Africa working with businesses will be key drivers of eco-innovation. This is why the Center for Global Eco-Innovation was established at the University of Benin in partnership with Lancaster University. Since then, we have focused on the conversion of waste to energy through a £7 million RECIRCULATE and £800,000 Actuate translation project funded by the UK government's Global Challenge Research Fund.
1.3 billion people live in Africa, and this will nearly double by 2050. That is a lot of mouths to feed. If we already struggle with the food insecurity, it means that we need community-based innovative ecosystems and collaborative research that addresses our food challenges in practical ways. This is our mandate at the Africa Innovation Institute. However, to ensure progressive outcomes, the role of government cannot be overemphasized.
Governments can implement policies that limit the causes of climate change, but we need the right strategies to support those policies. That means new ways of generating and using energy, managing water, and dealing with waste. Commercial companies, including small and medium-sized enterprises, SMEs, and specifically innovation-driven enterprises, IDEs, will be key players in delivering new eco-innovative products, services, and technologies.
Resource-based economies are common throughout Africa. In the copper belt mining sector here in Zambia, There is a huge need for innovative capacity building to ensure inclusive, resilient, and sustainable low carbon recovery and economic growth.
As a university, working in partnership with government, businesses, and civil society, we are able to create innovation ecosystems. Research is able to move beyond the publication of papers as output and into the creation of impact in society. Our students play a vital role in this.
The Centre for Global Eco-Innovation has supported companies through graduate and postgraduate research projects lasting up to 3 years, driving forward eco-innovative products and services through industry links.
I believe that partnership is everything. The maintenance of international collaborations and mutually beneficial relationships through co-design and co-delivery binds our networks together. Over the last 10 years, we've established good working relationships with our African partners. From these collaborations, the RECIRCULATE and Actuate projects have emerged from funding by the UK Government's Global Challenges Research Fund. These projects are incredibly rewarding and genuinely transformational. Lancaster's eco-innovative vision is making real progress and impact internationally.
The challenge is huge, but the opportunities are clear. The road is long, but the journey has begun. This isn't about incremental change. We should transform the ways that government, academia, industry, and society work together. By directly addressing the UN Sustainable Development Goals, we aim to address societal, technological, environmental, and economic challenges affecting Africa. We should focus our attention on the art of collaboration. Our network continues to expand. The impact is growing. Whatever your area of expertise, we can build a better future for everyone by working together. Join us.